Why do IVF cycles fail? This is one of the commonest questions which patients ask, and I'm Dr. Aniruddha Malpani at Malpani Infertility Clinic, and I'd be happy to answer this question. And the honest answer is we actually don't know. Obviously, this is not an answer which any patient wants to hear, and it's not an answer which any doctor wants to give. After all, aren't we the specialists? Aren't we supposed to know everything? But the reality is that human reproduction is not an efficient process. Even fertile couples take time to make a baby in the bedroom. So it's hardly surprising that even when we do IVF and we actually make an embryo, that most of these embryos don't implant successfully. We can label this failed implantation, but really we're not telling you much. All we're describing is the fact that the embryo we transferred did not implant, and often we don't know the reason why. Sometimes we can pinpoint stuff. For example, we could say, okay, the lining was poor or the embryo was poor quality. But when you have a top quality blastocyst, you transfer it into an endometrium which is thick and trilaminar, and the transfer is smooth, and yet the patient doesn't get pregnant. We honestly don't know why the cycle did not work. And I think not only do doctors have to come to terms with our ignorance, patients need to do this as well. The trouble is, patients are very unhappy. They're looking for answers. They want their doctor to answer their questions, as a result of which doctors do lots of pointless tests such as endometrial receptivity assay, TB PCR, hysteroscopies, immune testing, NK testing, you name it, it's a long list. The fact that it's such a long list means we really don't know what we're doing. We're groping in the dark. The reality is sometimes you're just unlucky. That's the reason the cycle didn't work, and you just need to be patient till you hit the jackpot. Have any questions? Feel free to ask me.